did pop out chat go to? Hey. All right, there we go. I wish I could get rid of that sign in thing. That's so annoying. I don't know what that is. How's everybody doing? You guys tell me in chat what you think the answer is. We're just picking up where we left off yesterday. You like A? Perfect. Good job. All right. What do we think about this one? When we're treating fractures, how are injuries categorized? Not D, it's A. And that answer can be found in your CPT book on page 127. Next one. How are procedures reported for the application of casting supplies and straps? Yep. They can be coded separately, and we will need to code them if they're here for a subsequent replacement cast. And that also can be found on page 127. Ooh, E&M. Are we established or new patient? There you go to settings, stream. Go to stream. Connect connected. Go to the top menu and select Docs. Everybody saying C on this one? Good job. Perfect. Which modifier are we going to use? 78, 62, 59, or 25 for this one? Trying to figure out how to get rid of this sign in to chat thing on UBS or OBS, but I don't know if it's going to help. Go to view menu. Y'all are saying B, 62, two surgeons working together as primary surgeons, forming distinct parts of a spinal deformity. Distinct parts? Indeed. 154 is your page number in AMA CPT for that correct answer. Ooh, these are all in 218 area. Are we a 2182 or a 2181 for this procedure? Howdy, howdy. How's it going? If anybody's in the course for CPC with me, I've been adding, you can't see it obviously, but oh well. I got a ton of new material inside the course today. Emergency department. My exam is scheduled for June 3rd. Oh, I'm so glad you love them. That's awesome. Let's go to that one and see what do we have for properties. Yep. If by chance you're on my website and you're a member of the website and you want to do practice questions, I have a bonus area that is located right there. And if you go there, you can do these practice questions, which are in that drop down menu. Let me fix this real quick. Edit, transform. There we go. And there's a drop down menu right here at the side, and it's got all 18 areas of practice exam questions like integumentary and, whatever you want to do, ICD-10. And you just do the practice questions here. And then at the very bottom, you can hit submit and it'll grade for you. There's a ton of practice questions inside each area. That's just, whew. And then you can hit submit and then it'll grade for you. So, when you finish this set of questions, if you ever wanted to, you could do the drop down menu right here, go to programs and click on that program, which is called this one right here. And you just quit the program. Yep. And it'll erase all your answers. And then you can go back in there and go redo all those questions again, which is really kind of cool. Of course, I've got a ton on each one of these pages that you could do individually because those questions are like, like if you wanted to do one at a time and see if you got one of them right, those areas are great. You could just click on it and it'll tell you whether you got them wrong or right individually. But if you wanted to do like a real practice exam that all the questions, you join this program right there and drop down menu and pick out which one you wanted to do. And then when you get done with doing all those, you can go to your drop down menu right there and quit that program and then restart them. Just go to the word programs, which is really cool, and quit that program and it'll erase all your answers and stuff. Don't forget about the free resources because I do have free practice questions right there that you can go to. And there's free PDFs that you can download, like that one right there. You just click on it, it'll download. Pretty cool. You can download and do a ton of practice questions in this area. Just click on whatever you think the answer is, and it'll instantly tell you the rationale. You can join another program, which is right here, which is all the E&M flashcards that I have. So you join this program, it's totally free, and it has 3 practice quizzes right there for E&M. And you can do these, entering your answers, whatever you think they are, hit submit. And then when you get tired of doing those, or you finished all 3 of them, you can go right there to your account settings, go to programs, and you can erase all your answers by quitting that program. They don't make it easy on this website, but you can quit it, quit all the program right there, and it'll erase all your answers. Um, and then you can redo those all over again if you want to do the E&M flashcards all over again. That way you can do them over and over again. But all that's free. Don't forget you've got free CPT book prep too, where you can see how I make my notes and you can make your own, just like mine. And there's also free book prep videos that are right there too. You can watch me do the digestive system and do all those practice exam questions right there. Yep, yep, yep. And then under the FAQs, there's a bunch of free resources like grants and scholarships and free practice questions from other exam teachers, all kinds of resources that are underneath all the FAQs. Social media links have all of the Discord, Twitch, study groups, Red Note, Amazon list if you want to know which books do I buy, what desks do I have, what highlighters do I use, what pens do I use. Everything that's within arm's reach of me right here is literally right here on this little list of Amazon items. Everything from, I used to use that camping desk all the time. It would lower and stand until I got my electric one. So I love it. I love the white one is the one that I have now. And it goes up and down with the push of a button. But for 2 years, I had that camping desk that was, I could raise up and down and make it into an L desk. But anyway, all that's over there if you're curious or need help with anything. There we go. What did you guys think was the answer for this one? I think y'all said A. A is correct. Good job. What about this one? Ooh, do we have stuff in respiratory and integumentary? Which modifier would you use? 51 or 59 with these? It's one of the first things that I would look for is what modifier would go with these codes. What do you guys think? Echo. I got 8 out of 10 that gave a thumbs up. Thank you, thank you, thank you. Yay, now we got all 10. Anybody want to take a guess at this one? Wound Explorer. Where are we going to be? Another A. Perfect. Good job. All right. Are we unspecified with a bunch of nines? Or would we be up here, a 215 or a 214? Open treatment of a dislocation of a jaw. If we go to this location in our CPT book index and you go to your jawbone, right? You can tell what your answer is by just picking out whether your procedure is open or closed. It will tell you exactly what the answer is, too, which is cool. Cool, cool, cool. You like C? We had A for this one. If you go to page 142 of your CPT book, it says that 21490 is for open treatment of yep. All right, what about TMJ manipulation using MAC? Indeed. A would be correct. What book am I in? Yep. 139 is where your answer is for that one. Think about if we might need a modifier. Would we in this area? 78 is an unplanned return to the OR. Would we have one or would we have two codes in this area? The 19 is in 3 of the available answers. Would you code a diagnostic with a removal of a foreign body? It is only 19 because there's no global period. We know it was in a prior surgery, but because it was over 90 days, 4 months ago is 120 days, we would not add that 78 modifier. So it's a brand new surgery. It's not considered part of the prior surgery any longer. Makes you wonder that, like, a lot of doctors will ignore the patient and not do anything about it until after the global period. And then that way they can bill and get full payment on the procedure again for going back in to get the clamp. The patient undergoes an amputation. Which one would we be? 014 or 015? The 62 is very different than your 80 and your 82 from your 520. Yep, because of the 90-day global period. Yep. What are you guys thinking about this one? Definitely not 62 because it's a closed procedure of the lower ankle, you know. Definitely not that one. Yeah, it was posted. Yeah, since yesterday. But we just started. Who Star Wars sent a trophy for 1,000 jewels? What the heck is that? What in the world? Look at that cat. I was just looking at a picture too on my phone. One of my kids was drawing a computer picture of one of our cats. Look at what he did. He's got a toes up. And I just hearted it. He just sent me that just a few minutes ago. I'm like, that's a really good picture of the cat. But I love that trophy cat. Or I guess it's a goat. Yeah, I'm slow. It looks like a cat from here because it's got ears like a cat. And I was just looking at a cat picture, but that's actually a goat. I heard tell I was the goat of Reddit. Although I need to get me on Reddit and start posting on Reddit. But I hear a lot of people talk about me on Reddit. That's the first time I heard of the word goat. That's so cool. That is so cool. I love it. The trophy goat. That is so cool. I think that's first gift in a long time. Yay. YouTube will be super happy with me. Yep. All right, let me get rid of that camera out of y'all's way. How are we going to amputate this foot? Which anesthesia code are we going to use? Everybody saying B? It was A. It was the radical resection, including below the knee amputation, which is on page 71 of your CPT book. Ooh, E&M. Are we a discharge? Are we a subsequent hospital visit? Are we a observation? Or are we a discharge? What do you guys think? What do you guys think? He discharges her and it takes about 20 minutes. Which one are we going to code for 20 minutes? Just put your answers into chat. Somebody says A. Perfect. Good job. Are we a new patient? Are we in the ER? Or are we in the ambulance? What is our patient status for this one? Perfect. Good job. Anesthesia. Again, we've got debridement of the sinuses. Oh, 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 60. A is a parent code. B is a child code. You can't do anything with it. Be sure to look at its mama code, which is the 40 code. 90 is a parent code. And 64 is a child code. You got to go look at its mama, which is 60. Ninety is for facial bones or skulls not elsewhere classified. 60 is for nose and accessory sinuses. 48 is eye. We know we're not in the eyeballs. You can at least get rid of that one. 64 does biopsy. Infection led to massive debris in the sinuses. Ooh. I wonder if that had anything to do with anything. $60 is correct. Good job. Perfect. Are we in the ER? Are we doing an office consultation? Are we doing an hospital admission consultation? What's our patient's status? D, 82 minutes decision making with high. Good job. Perfect. They say that answer is on page 25 of your AMA CPT book. All right, where are we at? Are we home or skilled nursing center? Where are we at? Are we new or established? Those may be some of the differences for sure. Chloe, move your furry butt. You like C? 39 minutes initial comprehensive visit. Perfect. Excellent. Ooh, another anesthesia. 014s. 38. 380. Are we under knee or patella or yep. And then we got 80 is under closed procedure. 402 is under open or surgical scopes. 82 is under diagnostic scopes. Are we doing surgical or diagnostic? Maybe it states closed. Maybe. Of the knee joint. Perfect. A is correct. Good job of noticing that. Are we doing, another aspiration, but it is image guided. So we're doing cervical and we're dealing with spinal cord. We did it under the skin. 19s. 019. Lymphatic system. Neurological agent. What kind of image did we do? Okay. And then 91 is nerve block injection. Other than prone position. What do you guys think? $87, 37, 37. Yep, perfect. We were doing an aspiration, not a nerve block. All right, are we a 14, 10, or 20? Also, modifiers. P4 means they're super sick or super healthy. Patient, 73-year-old probably would not be a P1. We could get rid of that. You know you need to have the 99 100 if they're that age, so we can get rid of that one. So then it just leaves you with those two. Are you a 20 or a 14? '20 is under radiological procedures. Right. Or no, I'm in the wrong area. 009, not there. 009, 14, and 20. 14's got a different parent code than 20, which means they're under two different body parts in general. Yeah. On 14, you got to go look at the number 10, see if you're in the right area. A is correct. Good job. Are we? Ooh, let's see. 0, 1, 2, 3, 4. I like that code number. It's radical, but you got to go look at mama, which is 0, 1, 2, 3, 0. B, 0, 1, 2, 0. Closed procedure involving the hip. B is correct. A is a scope. This is an orthoscopic procedure. And this saying it's just a relocation of the hip joint means we just manipulated it and put it back into place, which was a closed procedure. Muscular skeletal. We have 3, 2, 1, and 2. We are on the left. So just knowing your little trick about diagnosis codes might get you down to just 2 different available answers. 90 is an application. 94 is a removal. 92 is also an application. And 38 is a replantation. Perfect. These are called nursing facility services. Another anesthesia one. We got a 75-year-old with their first pacemaker. What do you guys think? Yep, just needed to look for that 75-year-old needing that 99-100 actually. Are we an established patient nurse visit level 2 or level 4 or level 3? Yep. Hear Travis from here screaming in his room. Oh. What in the world? Y'all like C is your answer? Awesome. Good job. All right. For evaluation and management, which of the following criteria is required? So far, as of today's date, do we need to know if you're married or not, or your living arrangements? What do you need to know for an evaluation and management code? Time documented for services, recovery, whether they're in a global period or not, right? Medically appropriate history and exam when performed. Let's see if Mia's right. Yep, you are correct. Good job. It's like a couple of answers are correct, but which one's the most correct? I hate those kind. For 99497 and 99498, what do we do with these codes? What's going on with these? I am streaming on YouTube, which is a little bit better of a view. And we'll be having a contest over there too, where you could win um, a month's free of my book prep videos and podcast and all that kind of stuff. So just saying. Living Wheels, perfect. All right, what's going on in our CPT codes? We've got 3 of them that start out with 298, one of them that is a 274. Those are usually grouped together in different headers, blue or red in your CPT manual. If we're doing a medial and a lateral meniscus repair, what would be our answer? What do you guys think? C or D? C is or, D is and. What do you guys think? A lot of people on YouTube are saying D. Yep, there you go. Perfect. All right. What about these codes? They all start with 276. So they might be underneath the same grouped headers. If we're doing a repair on a ligament, which code would we be? 95, 96, or R50 or 75? What do you guys think on this one? Sammy likes D. D is correct. Good job. Anesthesia. What would we pick for this code? We are harvesting donated organ. What do you guys think? Would we need to add that P6 to our anesthesia or not? Hey, Mackenzie, how's it going? Some people say C, some people say A. They want A. I'm curious though, because it's already in the descriptor. So it's, yeah, because it already says the patient is brain dead in that descriptor. So I'm wondering if their rationale is correct, but I'm just curious. Anyway, says the answer is on page 65 and 73 because a lot of times we don't add those if it's already in the descriptor, but good question. 600s. Are we in 04, 20, 40, or 70 for a spinal manipulation? Yeah, it seems redundant to me too, Go Kart, because it's already in the CPT code descriptor. You wouldn't add a modifier unless you needed to change it. What do you guys think about this anesthesia? 00604. That is a child code. You got to go look at mama, which is 00600. Everybody likes C on this one? Perfect. I'm sure you did, Julie. I got 1,000 or more to go through. I haven't, I have 9,404 in one email account. And what have I got in the other one? What have I got in this one? Only 3,000. and 58 in the other email account. I'm all like, "Ooh, I got a lot of emails." Oh, Lord. I do, I swear. I got a lot of emails. Sometimes it just is, like, so overwhelming that I'm like, "Oh, I eventually get to it." I try my best. All right, where are we at with this E&M question? Are we new or established? Those 8 and 9s in that 4th digit character will let you know. Yeah, it's rough being popular or the GOAT, as Star Wars girly over here has given me a golden goat trophy over here. Yeah, not complaining. I love helping out, but yeah. I got a lot of emails. Yeah, you sent it in Gmail. Okay. I try to be on as often as I can. I'm so impressed with there's a couple of followers or creators on TikTok and YouTube that I follow, of course, and they are so disciplined that they're on every day. Every day, no matter what, they at least go on at some point during the day. And that's my goal, is to do that once a day. That would be awesome if I could just find the time. And I retired to do this full time. And it seems like I'm busier now than I was when I had a full-time job. I don't know. I don't know where the time goes every day. It just goes so fast. B? B is correct. Good job. Don't let this scare you with all these codes. Look at the modifiers. We've got 59 modifier or a 51 modifier. What's more likely the correct answer, right? Based off the code selections. They're all in the 20,000 section. What modifier would you have with multiple codes? It's kind of interesting. Something cool to look at, try to figure out. I do have CCS questions. We have a whole room inside of our Discord study group that is completely full of CCS practice questions. I even attend your guys's webinars and post screenshots of all the webinars that I attend for that. And even have practice questions on my website, right? That we share. Let's see if I join this little practice question thingy here and do my drop down menu. Don't I have PCS questions over here to the side? I need to sign in to this. Why am I not signed in? Here we go. Join. Can't do it right now, but I've got a lot of them even on my website. I even have YouTube videos and notes for PCS. Hey, Phoenix. You guys like C? Amy likes answer C. C is perfect. Very good. If it would been 59, then that would mean like a totally different, separate, like spinal column. Like you'd have to be totally different leg or something. You know, you put down a set of instruments and you open up another leg or something. So that 51 modifier is great to notice on exam day. 231 all the way down, so they might be under the same surgery header, which is great. 23120 is our first code in numerical sequence. Partial or total, and then 50 is a different bone, and then 80 is a partial. Are you doing partial or total? That would help you out for sure. This is for a partial. Perfect. D is correct. Good job. Do we have a 99204? It's in 2 of your available answers. 3 of your available answers have a status code, diagnosis code, a Z code. Only 1 has an injury code, an S72. These are all things that help me try to figure out what's going on. 2 of our answers have modifiers, 58 and 76. I can use any of these things to help me organize available answers, know what to look for in the exam question. 76 is a repeat. 58 is a staged. Do we add even the D and the X at the end of the M codes? Is that something you even see? Might be. You tell me. I know we see it at the end of S's, the S72s. Do we have 7 characters at the M's? This is just a planned return for a new cast by the same doctor. So isn't this just a post-operative casting change? We're going to have our injury code, right? The S code. For subsequent encounter. for our fracture of the femur. That would have given you one clue that it was D. The 58 modifier is also helpful. Travis is just screaming away. For a recasting, are we doing standby services, or do we have a healthy baby, or do we have a blue baby? What have we got going on? Do you know your E&M category headers for these codes by site? I'm glad you see that now, Amy. That's awesome. Can you 2025 training manual for the CPC course? Yep. Yeah. C is correct. Good job. We had a healthy, happy baby. No issues. Are we doing a nurse visit? Or are we a level 2, level 3, or level 4 in the ER? Where do you get these questions? Good question. So if you go to medicalcodingbyjen.com, my lovely little website right here, you go there and you scroll down to these purple boxes. This one right here is Join Pocket Prep Practice Questions. If you click the link and then go to Medical, the top link is aapc CPC exam questions. You can get access to 750 practice questions with answers, rationale, and page numbers of where the answers are with a pass guarantee right here. Really reasonable rates. I usually just pay for a whole year at like $92 or something and get it at $7 a month, I mean. But you can sign up and do like 3 months for $40 and then cancel your subscription that day, but you'll still get access to the questions. These things are so great. And like if you just pick the wrong answer, right? And you go to show explanation, it will actually define every word for you, like anything that you need to know. You also have a link that will tell you what page number inside your manuals of where the answer is. And we now have a chat feature that before you answer the question, you can hit tutor over here and you can ask the tutor like random stuff. What I'm seeing is that there's a low MDM, like low MDM, but also 20 minutes. Like if there's something that's confusing you in the question, you can hit the tutor button now over on the side and hit submit. And then the chat will talk to you about it. That's a great observation. Yes, you're correct about this and that. And it'll tell you all the stuff that you need to know about this question before you answer it. It's really cool. They've really shown some really cool options, and they'll even reference you in that chat with that tutor what page number inside your CPT book that is referencing you to, so that you can go to page 30 and you can look up that guideline, whatever they're talking about, and look it up before you even click the answer. It's really cool. Pocket Prep. I mean, 750 questions for 40 bucks plus your own tutor, and um they're always doing all kinds of stuff. Like they'll have me do a an hour-long tutoring session with some members. They have giveaways. They have a grant that you can apply for and get free access. Um, for the price and the amount of questions, 100% great. I love Pocket Prep. And if you are ever questioning the reason why an answer is what it is, and you don't think that they're correct, you can always just hit the help button and give them a copy, like highlight, copy, paste the question in there and say, you think the answer is this. The person that wrote the question will get back to you and give you their rationale of why they think the answer is what it is and talk to you more about it the next business day, right? And then if you do find an error in them, they'll fix the question. I've been trying to fix AAPC's practice questions for I don't know how many years, and I'm a licensed instructor from them, and I can't get their questions fixed. But I can get Pocket Preps when I find an issue with them, if I ever do. But their new Tutor AI is great. And even when you're hitting show the explanation, now with the definitions, like you can figure out where the definitions are for all kinds of terms in here. It's really very cool. I love it. And of course, if you guys do use the link here on my website, they do send me like a couple of dollars from your membership monthly, which is cool because I give it right back away to you guys. So, like right now, we will give away 3 memberships to. Sorry, I'm trying to adjust the screen here. Let me fix this back the way it was so that we can go back to the way it was formatted. But if we if anybody is on YouTube, let's give away 5 memberships to my YouTube channel, which is 26 bucks. And I'm just going to send YouTube the money and then they'll pick a winner. So if anybody wants to hop over to my Tube of the U channel and join in the chat room, I'm going to give away 5 memberships, which gives you access to my old workshops, my book prep videos, and my duck classes, and the podcast where I'm just reading out the guidelines to you, telling you what each sentence means individually. There's quite a bit of stuff over there. The only thing it doesn't give you access to is just the boot camps, because those are just individual purchase replays if you want to watch those, because those are 8 hours of content. It's a lot. But everything else you've got access to over there. Here from TikTok. Yay. All right, let's give it away. Let's give away. We send them some memberships. Sending now. And thank you again for my goat trophy earlier today. That goat trophy gift is very cool. So we gave away memberships. I just send them the money and then they pick out the winner. So it looks like Lammy won. You, the one from TikTok, you just mentioned that you were there from TikTok and then you won. Congratulations. Prath did, Kimberly did, Spring did, and Christina all won YouTube memberships. You've got access to all my videos. So when you're on the YouTube channel, So if you go to free resources, right, and go to the social media tab, click on YouTube, move Chloe. You're here on YouTube. Be sure to click across the top of the banner right here, right? Podcast is listed right there. Playlist is listed right there. If you scroll down, there's the cool duck classes are really, really cool. It goes into extreme detail of hard practice questions and why each answer is what it is, plus showing off the books to let you know where to find the answers in the book. Those are wonderful. And then the ICD 10 book prep and the CPT book prep. Those are all great videos. You can also go to the post page, which has a ton of practice exam questions. Just click on what you think is the answer, and then it will tell you what the answer and rationale is. There's probably 1,000 practice questions over there that you guys have access to for that right now, which is great. It's just a $4 membership if anybody's interested in it, but you can always win them free every time I go live. I always give away 5 every time I go live. During the workshops, I usually give away 10. All right, for this one in Pocket Prep, what do you guys think is the correct answer? And I know they do give me a little bit of money off of y'all's sponsorship, but I wouldn't even promote it or put it in my shop if I didn't believe in it 100%. Like, I even have AAPC's material that I license and purchase on behalf of AAPC for you guys, but I won't even put their practice questions A, B, and C in my shop because I don't like those questions. I think they're too easy and not worth your time of spending $80 on. But I do put DEF in my shop that you could purchase from me from AAPC because I like those practice questions because those are more difficult and worth $80. So I'm sincere. I really do like Pocket Prep and I don't take sponsorships lightly. You know, part of my 9,000 emails is companies reaching out to me wanting me to sponsor this, that, and the other thing. And I don't do it unless I really like the company and I buy it myself. I've got a year's membership on Pocket Prep myself because I like their practice questions. And they're just adding more and more features to it that are wonderful. I like the new little tutor thing so you can talk out loud about their question with them. It's pretty cool. What do you guys think is your answer for this one? Somebody said B. B is perfect. Who was that? Was that Courtney? Sammy? Good job. That's all right. I'll try to be back tomorrow, Cassandra, and do it again around the same time. It's a holiday tomorrow, I think, anyway, so maybe a lot of people will be around. What about this 15-monther? Are we going to code a 15-monther in the 71s or in the 66s? What do you guys think? Everybody saying C? C is correct. Good job. All right, we got a bunch of 266s. Oh, 08 is percutaneous. 05 is a closed procedure, but you have to go look at its mama to figure that out, which is 26600. 50 is percutaneous, and 76 is percutaneous. Did we go through the skin or did we do a closed procedure? So we can get rid of O5 because we know we went through the skin, right? What do you guys think? Hey, Deanna, good to see you. Good go-kart. Travis, what are you doing? What are you doing? Stop. That's not appropriate, Travis. Squirting whipped cream in his mouth. You eat that with the strawberry pie that Grandma made. Well, you don't get the whipped cream if you don't eat the pie. That's how life is. What did you say to me? Mommy, can you please, I need more watermelon. Can you please order some more? That was a better rephrasing of that. Sorry. Sorry. Like 08? My dogs have been running. My dogs come running for whipped cream, I bet. Travis is just a sugar fiend. He should not be just in there just eating sugar right out of the can. What type of soft tissue tumor resection is commonly used for malignant tumors or aggressive or very aggressive benign tumors? I need dessert. Radical is right. If it's malignant, we are doing radical. Perfect. Would these techniques need a 50 or a 59 modifier? 226s? What do you guys think is the answer for this one? We're looking for each additional space. Don't forget to look at your mama code, which is 22600, because everything that's inside her is inside her children, all the way up into the semicolon. Mama says she is posterior or posterior lateral technique. And then 12 is this. And then 14 is here. What do you guys think? Black butterfly Bella, thank you for the follow. Got more C's than anything, but it's A. You don't need that modifier because mama code is posterior lateral. Yep. A was your correct answer on that one. 260, 11, 10, 34, and 55. Hey, Elizabeth. Good to see you. What are we getting for 260? Travis is ravaging the refrigerator. Oh, my Lord. $260.11 is complicated. Got to go to Mama to see what she's doing. That's our 260.10. 260.55. Different body part. $55. Yep. And 34. Some of them are dealing with abscesses. Some of them are dealing with bones. And some of them are dealing with tendons. What are we dealing with? What are we messing with? Uncomplicated? Yep. D is correct. Good job, Sammy. Are we a discharge? Are we a consultation? Are we subsequent hospitalization? What are we doing? What is our category header for this patient status? What do you guys think? A is correct. Good job. All right. What about this 3-month-old? We got 1P2, 2 age additions, 1 without. What do you guys think? Two of them with the same first CPT code answer. Thank you for the 1,800 taps on TikTok. Thank you for the heart me's and the shares. All that stuff means a bunch to TikTok. Homemade pie. Oh my goodness. I know. My mom's the best. Indeed. C is correct. Good job. A lot of these have 004 versus 005. Usually, when the first 3 digits of your CPT code change, numerical numbers, that usually means they're under different headers. So 004s are under thorax, chest wall, and shoulder girdle, where our 005s are under intrathoracic. Do you know the difference between your chest wall and shoulder thorax area versus your intrathoracic area? Knowing those differences and what you will see up here in your exam question is vital for exam day. For sure. What do you guys think is the answer for this one? Go-kart's going for the scope and a removal. 50 is sternal debridement. 474. It's a radical procedure of a rib resection. And 72 is a repair of a rib area. What did we do today? Sammy likes A. We are B. We are 74, which is a radical procedure. Let's check out the explanation. Since we had to have several ribs removed, that's kind of like life changing, right? The protection around the heart and lungs will be removed. They are considering that to be a radical procedure. Very cool question. We're on page 67. Just make note, go-kart, that 40 was a scope procedure. It says including surgical thoracoscope in the parentheses. That might help next time. So if you don't see scope in the question, then we didn't do a scope. All right, this question. Are we doing a wellness exam? Or is our patient new or established? Amy was thinking it was a punctured lung. Yeah. This was a repair of an injury after a car wreck. Good question. You won't miss it if you see it on the exam. We have an established patient. We can get rid of your new patient. A is correct. Good job. What do you guys think about this one? Would we need modifiers? Would we need to times things in this area? Do we need to add microscopes to these codes? That's 999 code. What do you guys think here? Mm. Why it's saying a warning that I need to keep engaging. What? Maybe I didn't do the puzzle piece, but not sure. Hard to see them. $54 is below C2. 52 is also below C2. Are procedures below C2? Travis, what are you doing? Swear, I gotta go see what he's doing. He's tearing up my kitchen. What are you doing? Somebody, it sounds like you're digging in the dishwasher or garbage disposal. They're fencing. Mm-hmm. B. They say our answer is on page 149. 22,151. It says below C2. Below C2. Why are we going C4 and 3 here at this area? I don't know. I have to check on that question. For this next question, are we new or established? We are established. So, did we see a nurse or did we see a physician? Got a new problem, so it has to be established. Has to. All right, modifier. For a spinal bone graft, which modifier cannot be used? I swear it sounds like Travis is putting rocks down my garbage disposal or something. I don't know what he's doing in there. I'm gonna have to go check out and see what he's doing. 66, 62, 51. 62. You can't have multiple physicians on a spinal graft. It can only be one physician. All right, time for one more, and then I'm going to go check out what Travi's doing. Neck vessels in anesthesia. 00352. 00352 is simple ligation. 50 is vessels, NOS. 22 is needle biopsy of thyroid. 50. 52 for simple ligation of the nails. Go card, it was 62 for the last one. All right, I gotta go see what the heck Travis is doing to my kitchen. I hope this was helpful. Look for me tomorrow at the same time, same place. I hope y'all have a good Memorial Day. I hope this is helpful.